Alright team, we have a challenging case here. The patient presents with symptoms of vaginitis, pancreatitis, and dermatopolymyositis. What's our diagnosis?
Well, vaginitis could point towards a vaginal infection, pancreatitis suggests inflammation of the pancreas, and dermatopolymyositis indicates muscle and skin inflammation. It's a tough one, but I think it might be an autoimmune disorder.
I'm leaning towards a rare skin condition, possibly pemphigus foliaceus, given the combination of symptoms.
I agree with Leslie. Pemphigus foliaceus makes sense here, considering the skin involvement along with the internal inflammation.
I'm not convinced. Pancreatitis is a serious condition on its own, and throwing in vaginitis and dermatological issues complicates things.
There are other possibilities before settling on pemphigus foliaceus.
Enough debating. This patient has pemphigus foliaceus, and we need to act fast. Prepare for a wedge resection of the lung. It's risky, but it's our best shot at saving this patient's life. Let's do this. Tracy, you called me into your office. What's the issue?
Hawks, I heard you want to perform a wedge resection on your patient with suspected pemphigus foliaceus. Are you sure about this?
Of course I'm sure, Tracy. I have years of experience in these procedures. I know what's best for my patients.
I understand that, Hawks, but we can't ignore your track record. You've been wrong before.
That was one time, Tracy. I can't believe you're doubting me now.
I'm just looking out for the best interest of the patient, Hawks. Let's discuss this further before making any decisions.
Fine, but trust me on this. I know what I'm doing.
Leslie, I just checked on the patient after the wedge resection. Lung, and his condition is critical.
It seems like the procedure didn't work as we hoped.
Oh no, that's terrible news. We need to act fast to stabilize the patient. What are his current vitals?
They're not looking good. But besides that, I'm concerned about how we should approach Dr. Hawks. He recommended the wedge resection, lung, for pemphigus foliaceus, but clearly it wasn't the right course of action.
Frank, forget about Hawks for now. We need to focus on saving this patient's life. We can discuss the procedure and implications later. Let's prioritize the well-being of our patient.
What the hell were you thinking, you imbeciles? You nearly killed our patient with your incompetence.
We did our best, Hawks. We made a mistake, but we can correct it.
I still believe the initial diagnosis was correct. We just misjudged the extent of the resection required.
I disagree. I think we misdiagnosed from the start. It was a tricky case.
We all share the blame here, but we can learn from this and do better next time.
Learn from this. You better learn fast because this kind of negligence is unacceptable. You're all a disgrace to this hospital. I'll be taking over this case from now on. The rest of you stay here and figure out how to avoid killing another patient. So, Johnson, how's everything going outside of work? Any exciting plans for the weekend?
Oh, same old, same old. Just trying to relax whenever I can. Thinking of catching a movie, maybe.
That's nice. I've been engrossed in this medical case recently. It's really puzzling me.
Really? What's the case about? Anything I can help with?
Actually, I think I've just had a breakthrough. I know exactly what's wrong with the patient.
That's great news, Hawks. You should go check on them right away.
I will. Thanks, Johnson. Catch you later.
Wait, you're leaving already? No goodbye or anything?
Sorry, Johnson. Duty calls. See you around. Storms and...
Hawks, what the hell are you doing? You can't just barge in here without the proper gear.
This is a sterile environment, Hawks. You're putting the patient at risk.
Unbelievable. The disregard for protocol is alarming.
Hawks, explain yourself. Why are you here without any protective equipment on?
Ignore their comments. Pemphigus foliaceus was a misdiagnosis. It's aldolase deficiency.
Aldolase deficiency? What's the prognosis for that, Hawks?
Matter. A factly, prognosis is poor. Without treatment, it can lead to severe muscle weakness and even heart complications.
We need to act fast then. Let's get the patient on the right treatment immediately.
Thank you, Tracy. It was a tricky case, but I'm glad we got to the bottom of it.
You did a great job, Hawks. The patient is lucky to have you on their team.
Well, if it weren't for the incompetence of some of the other doctors, we wouldn't have wasted so much time on the wrong diagnosis.
Hold on, Hawks. You made the initial wrong diagnosis yourself. You can't just blame others for that.
I mean, my team should have caught that mistake sooner. It's not entirely on me.
You're trying to shift the blame, Hawks. That's not how we handle things here.
I need some air.
Hawks, let's talk this through. Don't walk away from this discussion.